Hello, this is Michelle from Physioactive Indonesia, bringing to you our Singapore Surgeon Insight series. Today, joining us is Dr. Ruben Manohara, specialist orthopedic surgeon from Shoulder Elbow Orthopedic Group, Singapore. How are you, doctor?
Hi, Michelle. Thanks for having me. I'm good. Thanks for the invitation.
Thank you for taking the time to be with us. Doctor, can you start by telling us about your qualifications and specialties, please?
Sure. So I graduated from the National University of Singapore about 20 years ago, and once I got my specialist degree, I've been did a fellowship in the Royal Infirmary of Edinburgh, where I specialized solely on shoulder and elbow pathology, as well as general orthopedic trauma. And so for the last 10 years of my practice, I've been purely doing shoulder and elbow sports injuries, fractures, as well as joint replacements, as well as general orthopedic trauma.
Okay, thank you for that. So, today we will be addressing an interesting type of shoulder surgery, the reverse total shoulder replacement. Doctor, can you explain to us about this, outlining the difference between a total shoulder replacement and a reverse shoulder replacement surgery?
Sure. So your shoulder joint is a ball and socket joint. And in a total shoulder replacement, the ball and the socket are replaced with similarly a metallic ball and a plastic kind of socket. This is usually done for people with just arthritis as the main problem. The total shoulder replacement requires intact rotator cuff muscles, which are the muscles around the shoulder joint, for it to function. Now, a reverse shoulder is called a reverse shoulder replacement because the ball and sockets have now been switched around. So previously, the ball would have been on your arm and the socket on your shoulder blade. But in a reverse shoulder replacement, the ball is now on the shoulder blade and the socket is now on the arm. So the benefit of that is that this allows the shoulder replacement to work even when one does not have an intact or functional rotator cuff. It was originally created for people who had arthritis as well as rotator cuff tears. But the results of the surgery were so effective that the indications have now exploded to include treating complex shoulder fractures in the elderly, to treating massive rotator cuff tears in the elderly, for revision surgeries, and for tumor surgeries for people with rheumatoid arthritis, and usually as a salvage procedure following other previous failed shoulder surgeries.
Okay, so what are the factors that help determine which option a patient should opt for?
Okay, so generally, a total shoulder replacement is indicated for a patient who has, moderate to severe shoulder joint arthritis, and there isn't like an appropriate age to get it done. Usually the patients are in their 60s, but sometimes either from heavy use, manual jobs, very aggressive sporting lifestyle, or just genetic factors, people can get arthritis in the shoulders as early as their 40s and 50s. So if they've got significant arthritis in the joint, if they've already tried conservative measures such as oral or topical painkillers and anti-inflammatories, they've tried physiotherapy, they've had injections to the joint, they've tried changing their lifestyle, and despite all of this, they're still having progressive pain or worsening their function, or they can't enjoy, the lifestyle, or they're struggling with the activities of daily living, then we generally would recommend a shoulder joint replacement. The caveat is that a joint replacement is like a machine part, right? So it's got a lifespan, and typically we now say it's got like a 20-year lifespan, right? About 89% have a 20-year survival rate. So the earlier you get it done, the chances are you might need a revision procedure 20 years down the line. So that's for a total shoulder replacement. Now, for a reverse total shoulder replacement, because it is a bit more of a bigger procedure than the regular total shoulder replacement, it is generally indicated for patients who are older, 65 or 70, whose pathology actually fits the criteria for its use. Okay, so we try not to do reverse shoulder replacements in the younger patients below 65. Okay, so the original indication for reverse total shoulder replacement was cuff tear arthritis, which is when you have arthritis in the absence of a functioning rotator cuff. But after seeing the spectacular results for that procedure, now the indications have exploded to include a wide variety of indications. It's now used for massive and irreparable rotator cuff tears, especially in the older population. It's used for acute 3 or 4 part shoulder fractures in the elderly. It's used for various revision surgeries, following previous procedures to the shoulder. It's used in patients with rheumatoid arthritis, where both the bone as well as the rotator cuff quality is in question. It's used for cases of severe arthritis where there's advanced wear of the bones or associated with cuff tears. And it can also be used in cases of tumors of the shoulder to preserve shoulder function and for various sequelae of previous fractures or rotator cuff deficiency conditions. So I've done surgeries for all of these indications, but by and large, in our Asian population, the commonest indication is usually for cuff tear arthritis, massive rotator cuff tears, as well as acute shoulder fractures in the elderly. So I'm just going to go through a few examples here where you can see the surgery done and what the clinical outcomes were like. So in the first patient here, we have a 75-year-old Chinese lady. She's very active. She goes for dancing class, aqua aerobics, golf, tennis, drives, looked after her husband and grandkids. And she's been having both shoulder pains with reduced range of movement for many, many years. And she previously saw other doctors and they told her she had a frozen shoulder, pain and stiff. And she had multiple steroid injections to the shoulder, saw physio many times, wasn't getting better. The issue was constant pain and her daily activities. She was still independent. She couldn't do her recreational activities. So she came and saw me, and we can see from her x-rays here on the screen that she has very advanced arthritis. The humeral head has collapsed. There's no joint space. The bone is very sclerotic and thick. So that's what the reverse shoulder was done for her. And you can see on the video here, this is her just 2 weeks post-op, the right shoulder. She was already driving. She had very good range of movement, as you can see. And in this picture, she's 3 weeks post-surgery. You can see her operated side is better than her other side. And even reaching behind the back, she can reach her bra. Here's another example of a gentleman with arthritis and rotator cuff tear. He flew in from the Philippines to see me, actually. You can see he's had previous shoulder surgery with anchors in place. And there's also arthritis in the joint. And so during the surgery, we remove all those arthritic bones, the extra bone spur, the old implants, and now he has a reverse shoulder in play. And immediately after surgery, he could raise his hand again to thank me and reach overhead. And so these are videos of him. You can see he's now playing basketball, playing tennis, and able to go for a swim very comfortably. So another indication can be rotator cuff tears in the elderly. Here we have an 83-year-old lady with multiple medical problems who had a fall 9 months prior. And after the fall, she always had bad shoulder pain. And over the last few weeks, she couldn't even raise her arm. Now, the x-rays of her shoulder were unremarkable, but an MRI scan showed a full thickness, large retracted tear of the rotator cuff, with fatty atrophy, which just goes to show that, even if you tried to repair the rotator cuff, it probably wouldn't heal. So this is her reverse shoulder that was done, and then you can see her range of movement. At 6 weeks, it's full. You can't even tell which side was operated on. And finally, another common indication would be for shoulder fractures, usually for the more complex 3 or 4 part fractures. Here's, you can see a 4 part fracture in an 86-year-old patient who was still very independent and active, did all the gardening in her house. This is after the procedure, and that's her range of movement post-procedure. You can see she can reach external rotation, internal rotation behind her back, and forward elevation is symmetrical. And similarly, for another 74-year-old patient with a very badly displaced 4 part fracture, very good range of movement. Previously, it was thought that shoulder replacements for arthritis and rotator cuff tears did better than shoulder replacements done for fractures. But I've my own series published in a medical journal where we looked at our outcomes of reverse shoulder replacements done for fracture as well as elective etiologies, and there was actually no difference. The fracture patients did just as well.
Okay, doctor. So, what does the surgery entail? Does the patient need to come and get an X-ray imaging first after consultation? And what is the the timeline for the surgery?
Okay. Well, I assume you're referring to patients from Indonesia coming for treatment in Singapore, right? Because I do treat many such patients. So, we can give you our clinic details and contact, and we can arrange everything in terms of the assessment, the scans, and all done, and then we can come to a plan. But otherwise, some of these patients, or most of these patients, already have some preliminary investigations done in Jakarta, Indonesia. So we can share this over email or over the internet, and then we can tell you. I can kind of advise what needs to be done, and if they're thinking of getting it done, we can make the arrangements beforehand in terms of booking an OT bed, getting a hospitalization, everything set for them. And so usually then they just need to touch down like about 3 days or so before the procedure for us to meet in person, do the examination, any final investigations. The surgery actually is just a one night stay. So they come in the hospital, they have the surgery for the day, they rest the night, they can go back the next day. Typically, I need to have a look at the wounds for the first 2 weeks to monitor for wound healing and any wound infections. So for a lot of my foreign patients, especially the Indonesians who are so close by, you can either choose to just stay in Singapore for 2 weeks while I have a look at it, or I'll see you for the first like 5 days before after surgery, and then you can go back home and then return again on the 14th day post-op for me to have another check at the wound. And after that, I send you back to Indonesia with some of our physio partners, such as yourself, Physioactive, to continue your post-operative rehab journey. And the subsequent follow-ups can be done over teleconsult, or if ever it's convenient for the patient to come back in Singapore, we can always look at it then as well.
Okay, and what about in terms of activities or downtime?
Okay, so if we're talking about the reverse shoulder replacement, there's no limitation put on the patient immediately post-op. There's no like immobilization in a cast or a sling. They are encouraged. In fact, they have to use it immediately the next day. Brushing your teeth, eating your food, laptop, computers, and reaching and whatnot. What they do need to remember is that there's a wound. It's about so big in over their armpit region that needs to be kept dry for 2 weeks. So when they shower, they need to. I usually tell my patients either to cover the dressing with cling wrap, or they can put like a large shower sleeve or something to protect the area for 2 weeks. After 2 weeks, it can be exposed. And other than that, it's actually activities as tolerated. And progressively, with the help of the physio, they'll do some strengthening and then they can return back to sports. There's plenty of literature, evidence in the literature to support that following a reverse shoulder replacement, one can safely return back to activities like golf, swimming, tennis, yoga, etc., without any problems. Okay, but of course you must bear in mind if you do heavier activities like bodybuilding, lifting weights and all that, that might cause accelerated wear of the implant, and you might be putting yourself at risk of a dislocation with carrying very heavy overhead weights.
Okay. And doctor, do you have anything else to add for in terms of information for patients about the reverse total shoulder replacement?
So what I would say it's not for everybody. Ideally, it's for the older patient, and old is it's a moving target. Something 70, something in 65, but like I said, it's like a machine part that's got a lifespan, and so the earlier you do it, and if you're thinking of a lifespan of 20 years, there's a chance of having to revise it. So the best time to do it is kind of around your 70s, plus minus 5 years or so. uh, it's not used for every condition. It's really those that either you have arthritis, significant arthritis, or irreparable rotator cuff tear or a complex shoulder fractures, or if you've had previous multiple surgeries before for various conditions and you still have a negative poor outcome, this could be a very suitable salvage procedure. Okay, that said, in this day and age, sometimes even younger patients are faced with very complex scenarios, and there's really no other alternative but a reverse shoulder from them. It still can be done. They'd have a good quality of life, they'd have a good function after that. It's a very easy post-operative rehab procedure. But then they might require a revision procedure further down the line if that were the case.
This is great information, Doctor. Thank you so much for your time and help. For our viewers, if you are interested in speaking with Dr. Ruben Manohara, you can find his details of WhatsApp, call, and website in the description below. If you're planning to get your surgery in Singapore and live in Jakarta, you can start your physiotherapy at Physioactive Singapore and continue your rehabilitation program in Physioactive Indonesia. On behalf of our team at Physioactive Indonesia, we want to thank you for tuning in, and we look forward to giving you more top quality content from leading industry surgeons. Thank you, Doctor.
Thanks, Michelle.